Hello everyone. Have you ever experienced burning sensation in the stomach, so belching, acidity or indigestion? In Ayurveda, these symptoms are mainly associated with a condition called Amlapitta, which occurs due to aggravation of Pitta dosha and impaired digestion. One of the most effective classical Ayurvedic formulation used to manage this condition is Avipattikara Churna. In today's video, we will explore the classical reference of Avipattikara Churna, its ingredients and preparation method, Ayurvedic pharmacological properties, therapeutic indications, mode of actions, contraindications, pathya and quality standards according to the Ayurvedic pharmacopoeia. So if you are an Ayurvedic student, researcher or someone interested in traditional medicine, this video will help you understand the formulation in a detailed and systematic way. Let's begin. Avipattikara Churna is a classical Ayurvedic formulation described in the text Bhaishajya Ratnavali, specifically in the chapter Amlapittadhikara verses 25 to 27. The primary indication mentioned in the text is Amlapitta, which corresponds to hyperacidity or acid peptic disorder in modern medicine. The formulation is designed to pacify aggravated Pitta dosha, improve digestive fire, eliminate toxins and restore normal gastrointestinal function. Here we see compositions of Avipattikara Churna. Avipattikara Churna is a polyherbal formulation consisting of several medicinal herbs along with sugar. The major ingredients include shunthi, marich, pipali. These three together form trikatu, which enhances digestion. The formulation also contains triphala, which includes haritaki, vibhitaki and amalki, and other important ingredients are musta, beed lavan, ela, vidanga, tejpatra, lavanga. A key component of this formulation is trivrutta, called nishottar, which act as a mild purgative. Finally, sharkara are added in large proportion to balance the formulation and reduce gastric irritation. Here we see method of preparation. The preparation of Avipattikara Churna follows classical Ayurvedic pharmaceutical procedures. First, all raw drugs are collected and cleaned properly to remove impurities. Next, the ingredients are dried in shade, which helps preserve their active phytochemicals. After drying, each ingredient is pulverized separately into a fine powder. The powders are then passed through 18 number sieve to obtain uniform particle size. After sieving, the powders are mixed according to the prescribed classical proportions. Finally, powdered sharkara is added and mixed thoroughly, and the preparation final is stored in airtight containers to protect it from moisture. Dose. The recommended dose of Avipattikara Churna is 1 to 3 grams, which corresponds to 1 to 4 masha according to traditional measurement. It is generally administered once or thrice daily depending on the condition. For the treatment of Amlapitta, the powder is usually taken before meals, as this helps reduce gastric acidity and improve digestion. Anupana. In Ayurveda, medicines are often administered with a suitable Anupana to enhance their therapeutic effect. Commonly used Anupana for Avipattikara Churna includes warm water, milk, honey, ghee. For patients with hyperacidity, lukewarm water or milk is commonly recommended because it helps soothe the gastric mucosa and balance Pitta dosha. We see now Rasa Panchaka. The pharmacological properties of Ayurvedic drugs are explained through the concept of Rasa Panchaka, which includes Rasa, Guna, Virya, Vipak and Dosh action. Most ingredients in Avipattikara Churna possess Katu, Tikta and Kashayaras, which helps reduce kapha and Pitta. Their gunas mainly Laghu and Ruksha, meaning light and dry, and the Viryas are predominantly Ushna, which stimulates digestive fire. After digestion, Vipak is Madhur, which helps nourish tissue and balance dosha. These properties collectively helps correct digestive imbalance and regulate metabolism. Now we will see overall Rasa Panchaka. The formulation has Katu, Tikta and Kashay Rasa, Laghu and Ruksha Guna, predominantly Ushnavirya and Madhur Vipak. Thus, Prabhav of this formulation is Pitta Shaman and mild Rechan, meaning it pacifies Pitta and gently eliminates excessive doshas. Now we will see Roganusar Doshagnata. Here we see in Amlapitta, aggravated Pitta dosha combines with Am and Mandagni, producing symptoms like sore belching, burning sensation and nausea. Mode of action of this drug is Triphala and Musta pacifies aggravated Pitta dosha. Sharkara provides Sheet and Madhur effect, which reduce gastric irritation. Trivrutta removes vitiated Pitta through Mrudurechan, and Trikatu corrects Mandagni and prevents Am formation. Thus the formulation eliminates aggravated Pitta and restores normal Agni, which relieves Amlapitta. In Vibandha, the constipation occurs due to vitiated Vata and dryness in the colon due to Ayurvedic perspective. Here, mode of action of this drug is Trivrutta acts as a mild purgation, Triphala promotes Anuloman of Vata, Snigdha and Mrudu properties helps soften stools. Thus, the formulation facilitates proper bowel evacuation and regulate Apanvata. In Durmanas, according to Ayurveda, Agni disturbance affect Manas because improper digestion produce Am, which influence mental clarity. Mode of action here, Dipan and Pachan drugs like Trikatu and Musta improves digestion, removal of Ama, restore clarity of mind. Proper digestion improves Sattva and mental balance. Thus, by correcting Agni and Ama, the formulation helps relieve digestive related mental disturbance. In Prameha, mainly arises from Kapha and Med vitiated with impaired metabolism. Here, mode of action of this drug, Vidanga and Triphala reduce Kapha and Med accumulation. In Dipan and Pachan action improves metabolic activities, and mild detoxification through Virechana helps remove vitiated doshas. Thus, the formulation improves metabolic balance and urinary functions. In Arsha develops due to chronic constipation, Mandagni and Vat aggravation, causing pressure on rectal veins. Mode of action of this drug is Trivrutta and Triphala relieves constipation, Trikatu improves digestion and prevents Am accumulation. Proper bowel evacuation reduces strain and pressure on anal veins. Thus, the formulation removes the root cause of hemorrhoids by correcting digestion and relieving constipation. Now, we will see mode of action. Avipattikara Churna works through several important Ayurvedic mechanisms. First is Dipana, which means stimulation of digestive fire. The action is mainly produced by Trikatu. Second is Pachana, which helps digest Ama. The metabolic toxins accumulate in the body. Third is Virechana, mainly due to Trivrutta, which eliminates aggravated Pitta from the gastrointestinal tract. Finally, the formulation performs Pitta Shamana, meaning pacifying of excessive Pitta dosha, mainly through ingredients like Triphala and Musta. Now we will see contraindication. Although Avipattikara Churna is generally safe, certain conditions require caution. It should be avoided in severe diarrhea, contains purgative drugs like Trivrutta, dehydration, pregnancy, very weak or debilitated patients, which is contraindicated to consume Avipattikara Churna. This is mainly because the formulation contains Trivrutta, which has purgative properties. Now we will see Patya and Apatya. Dietary regulation is very important while using this formulation. Recommended food includes light diet, rice and moong dal, buttermilk, warm water. Food to avoid include spicy food, fried food, alcohol, excessively sour food. This dietary restriction help prevent aggravation of Pitta dosha. Now we will see Saviryata avadhi. According to classical Ayurvedic text, the shelf life of Churna preparation is about 2 months. However, modern Ayurvedic pharmaceutics states that when stored properly in airtight container, the shelf life may extend up to the 2 years. Physicochemical standards. According to the Ayurvedic Pharmacopoeia of India, Avipattikara Churna must meet certain quality parameters such as loss on drying not more than 10%, total ash not more than 15%, acid insoluble ash not more than 5%, water insoluble extract not less than 20%, alcohol soluble extract not less than 10%. These parameters ensures purity, stability and presence of active phytochemicals. The importance of phytochemical standards, physicochemical standards. The physicochemical evaluation is essential for quality control of raw drugs, detection of impurities and contaminants, ensuring therapeutic efficacy, maintaining stability during storage. Therefore, these standards help maintain the safety, effectiveness and standardization of Avipattikara Churna. To conclude, Avipattikara Churna is an important classical Ayurvedic formulation used mainly for the management of hyperacidity and digestive disorders. Through its combined action of Dipan, Pachan, mild Virechan and Pitta Shamna, it helps restore digestive balance and improve gastrointestinal health. If you find this video helpful, please like, share and subscribe to the channel for more educational content on Ayurveda, pharmacology and classical formulation. Thank you for watching.